from the station that's on your side. This is Channel 7 News Daybreak.
Hey, welcome back into Wellness Wednesday on Channel 7 Daybreak. We're joined now by Dr. Devon Ballard from Sherwood Family Medical Clinic, and he's joining us today to talk about something called tennis elbow. You might have heard of it before, but it doesn't exactly have to be tennis to get something like this. And Dr. Ballard, thanks for taking some time out of your morning to explain. I know the name can be a little misleading, but explain what tennis elbow is and how it occurs.
So the medical term is lateral epicondylitis, but the elbow has a lateral epicondyle where a tendon inserts and a medial one. So when it gets inflamed on the outside, that's called tennis elbow. The inside one is actually called golfer's elbow. But tennis elbow is super. I've seen 3 people this week with it that had pretty severe pain coming out of the elbow area, and it comes down the forearm when it bothers you, and it's usually from a repetitive type motion. So they call it tennis elbow because tennis players turn the racket like this, so-called pronation supination. So if you do enough of that at work, let's say you're doing a screwdriver or manual, doing something with your hands. I had actually somebody a couple years ago get it because they were reading a book and they were turning the pages like this, but they would read 300 or 400 pages a night. They were reading a lot. And so it causes the inflammation of the insertion point around the elbow. And anytime you do a motion like this, shake somebody's hand, try to eat, do this kind of motion, it's very painful. And people are usually like, what's going on? And so it's definitely fixable, but definitely a very common condition that we see regularly.
How do you know when it's something like tennis elbow that might be a little more severe and extreme as opposed to, just soreness from doing something like that, just periodically? At what point, I guess, should someone come and see a doctor about it? How long should they wait?
Yeah, usually if it's a week or two or interfering, like my grip's a little weaker, it's hard for me to grip things, hard for me to shake people's hands, it's interfering with day-to-day function and activity, that definitely needs to be looked at. And the cool thing is some people can get something over the counter to start with called the tennis elbow strap, right? And I always tell people it does not go on your elbow, it goes on your forearm. And so when you strap it on the forearm, not enough to cut off the blood supply, but decently tight, it actually redistributes the insertion point weight and takes pressure off the tendon insertion and puts it in the middle of the muscle area and takes pressure off of it, which lets it get the time to heal. A lot of people can do an ice massage directly to the area, and inflammatories, of course, Aleve, Advil, Motrin help temporarily for a week or two, and it usually gets better. Sometimes we get formal therapy involved, or sometimes if it's real bad, an orthopedic guy they can inject the area directly with steroid to help cool it off. But it's definitely a nuisance and fixable, but can be a prolonged months and months kind of a phenomenon. So,
all right. Well, hopefully, if anyone's experiencing any of that right now, they can go and get treated. If you'd like to get treated from the great folks at Baptist Health, who will help you keep on amazing, you can always contact the number on your screen. That's 1-888-BAPTIST, or go to baptist-health.com for more resources. Dr. Ballard, great to see you again. We'll see you next time.
Thanks, Chris.